Welcome to the Patient Assessment Management Trauma Skill. In this skill, you will have 10 minutes to perform your assessment and voice treat all conditions and injuries discovered. You should conduct your assessment as you would in the field, including communicating with your simulated patient. As you progress through this skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example, blood pressure, will be given to you when you ask for it. You may assume you have two partners working with you who are trained to your level of care. They will correctly perform the verbal treatments you indicate necessary. I will acknowledge your treatments and may ask you for additional information if clarification is needed.
Dispatch information. You are called to see a young female cyclist that was struck by a car. You may begin.
BSI, is my scene safe?
Yes.
Mechanism of injury is cyclist struck by vehicle?
Yes.
And is this my only patient?
It is.
I will call for ALS at this time, and I'll have my partner stabilize C-spine while I begin my evaluation. Looking at the patient, I see she is a young woman laying on the floor with her eyes closed. I see no other life threats.
Correct.
Okay. Hey, ma'am, can you hear me?
No response.
I do a trap pinch. Seems she groans to trap pinch. I will then check the airway by doing a jaw thrust. What do I see?
It is clear.
Okay. Because this patient does respond to pain, I'll not use an oral airway. I'd rather use a nasal airway as long as there's no facial trauma or evidence of basal skull fracture.
There is no evidence of skull fracture.
So we'll measure and put in an NPA. Does she accept that?
Yes, she does.
Next, I will expose the chest and look for the rate, rhythm, and quality of breathing.
The rate, rhythm, and quality is 30 and shallow. You also observe on the right side paradoxical movement.
Okay, so she has a flail chest and she is in respiratory distress. We are going to start her on a BVM at one breath every 5 to 6 seconds with 100% oxygen.
Noted.
Next, I'm going to check her circulation. So checking for bleeding, doing a sweep.
You do see blood on the calf on the right.
Okay, we'll expose that and put pressure on the wound. Does that stop the bleeding?
The pressure stops the bleeding.
Okay, I'll have my partner put a pressure dressing on that. I would like now to check her pulse, checking the radial and carotid pulse. And what is the rate, rhythm, and quality of her pulse?
It's rapid, weak, and regular.
Okay, and the color, temperature, and condition of the skin?
Pale, cool, and clammy.
Okay, we'll treat this patient for shock. We've already got her on oxygen. We'll keep her supine and apply a blanket, and this will be a rapid transfer.
Noted.
Now I'm going to ask if there's anybody who could give a sample history. Any bystanders?
No, there is not.
Okay, I'll ask my partner to get vital signs. And what are they?
The blood pressure is 86/50. The pulse is 120, and the respiratory rate is 30.
Okay, I'll start my secondary assessment, starting at the head, palpating and looking at the head and the scalp, and coming to the facial bones, checking for integrity of the bones and the jaw. I'm looking for drainage from the nose or the ears, raccoon eyes or battle sign. See any of that?
No, you do not see any of that.
While I'm there, I'm going to check for the size of the pupils and check for pearl. And
eyes are pearl.
Are normal and pearl?
Yes.
Okay, great. Moving on to the neck, I don't see any JVD or tracheal deviation. I don't feel any step-offs. I'd have my partner secure a C-spine collar at this time. I will go on to the chest, checking the clavicles, checking the sternum. I'll palpate the uninjured side of the chest. Am I finding anything there?
You are not.
Okay, I would like to auscultate the chest. Okay, and what do I hear there?
Breath sounds are clear on the left and reduced on the right.
Okay, first I'm inspecting the abdomen, looking for any distension, any bruising, abrasions, any indication of injury. Do I see anything?
You do not.
Okay, Now I'm going to begin palpating the abdomen, checking for any sign of rigidity or masses. Do I find anything?
It's within normal limits.
Okay, moving on to the pelvis. I'm looking for deformity. I'm looking for any shortening of the legs. Also looking at the genital area for any bleeding, incontinence. I'm not concerned about priapism because this is a female patient. I'm going to gently palpate, checking for any irregularities of the bone, any crepitus. I'm checking the pubic area as well for any spreading there. Do I find any abnormality?
You did feel crepitations upon palpation.
Okay. I'll have my partner apply a splint, both for the fact that I found something on exam and also because of the mechanism of injury. Now I'm going to move on to the extremities, palpating. And do I find anything?
Just the wrapped injury.
Okay, moving down here. All right, now I'm going to check for CMS. Pulsus palpable and equibilaterally.
Yes.
Okay, wiggle your toes. No response. You feel me touch you?
No response.
Okay, I'm going to move up to the upper extremities, doing the same thing. Do I notice any abnormalities?
Her wrist is deformed.
Okay.
On the left.
All right, checking for circulation. Pulses present and equal bilaterally.
They are.
Wiggle your fingers.
No response.
Feel me touch you?
No response.
Okay, I'll have my partner put a splint on that wrist. At this point, I would like to get some assistance rolling the patient over, and we'll have a look at the back. So rolling her over, I'm just palpating the spine for any irregularities, step-offs, just having a look back there, no blood, and lay her back down on a spine board. I've had my partner manage all the abnormalities we found on the secondary, and now we're ready for transport. I'll be reassessing this patient, ABCs, vitals, and interventions every 5 minutes.